Your brain is doing something extraordinary right now. It's predicting the future, not in a mystical way, in a deeply practical way. Every fraction of a second, your brain is generating a forecast. What sound comes next? What word follows this one? What face belongs to that footstep coming down the hall? Most of the time, reality matches the forecast, and your brain barely flinches. But when something doesn't match, your brain fires an alarm, a beautiful, automatic, life-saving alarm. Now imagine that alarm is broken. That, researchers now believe, may be the core of schizophrenia. Let's start somewhere familiar. You're in a noisy cafe. Dozens of conversations are happening around you. You're not listening to any of them. Your brain has learned to tune them out. They're predictable background noise. They match expectations. Then, across the room, someone says your name. You heard it instantly, without trying. This is your brain's deviance detection system at work. It's constantly scanning for anything that breaks the pattern, anything unexpected, and it flags it automatically before you've even consciously noticed it. Scientists can actually measure this alarm in the brain using EEG. When an unexpected stimulus appears, a wrong note, an odd word, anything that violates a pattern, the brain produces a tiny electrical signal about 200 milliseconds later. They call it the mismatch negativity, or MMN. It's one of the most reliable signals in all of neuroscience, and in people with schizophrenia, it's dramatically reduced, or sometimes absent entirely. To understand why, we need to zoom in, way in, to a single connection between two brain cells, a synapse. At the heart of your brain's prediction system are structures called NMDA receptors, which are in the membrane of a brain cell. Think of them as tiny coincidence detectors. They only activate when two things happen at exactly the same time. A chemical signal arrives from outside, and the receiving cell is already buzzing with its own activity from memory. When both happen together, the connection strengthens. This is how the brain builds memory traces, the neural foundations of prediction. Now here's the remarkable part. There's a drug called ketamine that blocks these exact receptors. And when healthy volunteers are given low doses of ketamine in controlled studies, something striking happens. They begin to experience mild versions of the very symptoms seen in schizophrenia: paranoid thoughts, perceptual distortions, flattened emotions. The same drug that breaks the prediction system creates schizophrenia-like symptoms. This is not a coincidence. In people with schizophrenia, these NMDA receptors appear to be genetically impaired. Post-mortem brain studies consistently find reduced levels of key receptor components in the prefrontal cortex, the brain's command center for reasoning and planning. The result? The brain's memory traces become weaker, its predictions become less precise, and its ability to check incoming reality against those predictions, to sound the alarm when something's wrong, begins to fail. The brain processes speech and thought along two parallel tracks. One track is methodical. It processes what's actually there, word by word, sound by sound. The other track is generative. It's constantly running ahead, predicting what comes next, filling in gaps from context and experience. In a healthy brain, these two tracks check each other. When the methodical track catches something the generative track didn't predict, a deviance, it sends a correction. In schizophrenia, that correction system is impaired. The generative track keeps running. It keeps producing predictions, narratives, voices, but nothing is checking them anymore. Nothing is saying, wait, that didn't actually happen. This is how researchers now explain auditory hallucinations, the voices that people with schizophrenia hear. They are the brain's own predictions, mistaken for external reality. And delusions, fixed, unshakable false beliefs, may be the stories the brain constructs to make sense of these unchecked predictions. Even negative symptoms, the withdrawal, the blunted emotional responses, the silence, may stem from the same source. A brain that can't reliably detect change in the world gradually stops responding to it. Here's why this matters beyond theory. For decades, the main drug treatments for schizophrenia have targeted a different system entirely, dopamine. And they work for some symptoms, for some people, some of the time. But they've never touched the cognitive core of the disorder. Now, clinical trials are testing drugs that work directly on the NMDA system.
One approach involves boosting a molecule called D-serine, which helps activate NMDA receptors.
A drug called luvadaxistat does exactly this by slowing the enzyme that breaks D-serine down. In a randomized controlled trial, it actually restored the mismatch negativity signal in patients with schizophrenia. The brain's alarm, the one that had gone quiet, began sounding again. Another drug, BI-4-25809, targets the same system from a different angle, and phase 2 trials showed measurable improvements in cognition. These are early results. There's still a long road ahead. But for the first time in decades, researchers feel they may be targeting the right lock, not just managing symptoms, but addressing the core mechanism of the disorder. Schizophrenia has been misunderstood for over a century. Early psychiatrists called it dementia praecox, early dementia. Later, the focus moved to voices and visions, as if hallucinations were the disease rather than its symptom. What this new research proposes is something more fundamental, and in a strange way, more human. The brain is, at its core, a prediction machine. It doesn't just react to the world, it anticipates it, models it, tells itself stories about it. That capacity is what makes us creative, empathetic, and conscious. In schizophrenia, something goes wrong with the feedback loop that keeps those stories tethered to reality. Understanding that may not just help us treat schizophrenia, it may help us understand what it means to perceive the world at all.